This is Rise. Let's lock in with the goal of changing one life at a time. Yours. Together, let us rise up, inspire, strengthen, and elevate our minds. It's time to rise on the voice of Nassau Community College, 90.3 WHPC.
Hello, my name is Dr. Saran Heron, and welcome to Rise. Today we are going to talk about putting compassion into medicine. My guest today is Dr. Doug Slakey. He is an international recognized transplant surgeon, educator, healthcare professional, and administrator. Dr. Doug is currently a professor of surgery at the University of Illinois, Chicago, and the president of Process Health Consulting, a healthcare consultancy focused on enhancing and optimizing operations and process flow, emphasizing complex system management strategies that optimize patients' outcome. He is a speaker who inspires healthcare teams to provide effective and compassionate patient care. Dr. Doug is here to speak to us, especially if you're a frontline healthcare worker, caregiver, and provide key elements of how care should be provided. Despite knowledge and training, patient care remains fragmented, frustrating, and expensive, especially from the patient's perspective. He is also the author of the Process Manifesto, Improving Healthcare in a Complex World. Dr. Doug, welcome to Rise here on the voice of Nassau Community College, 90.3 WHPC.
Well, thank you so much. It's really a pleasure being with you and the audience.
Now, Dr. Doug, you are a transplant surgeon. How did you end up picking your career?
Yeah, so that was definitely the start of a journey. So it was pretty interesting, actually. I initially, in medical school, was convinced I wanted to be an orthopedic surgeon, having... Right. Like most people who are somewhat athletic, we've all encountered orthopedic surgeons, and I thought, oh, that'll be great. But when I actually did the rotation, I realized that they didn't have the longitudinal relationship with the patients that I found so important. And then, as often happens in careers, so much of our ultimate decision is really up to fate, right? And so it just so happened, I was at the Medical College of Wisconsin, and the three transplant surgeons were really an inspiration to me. And from a couple of perspectives, they were technically great surgeons. They had really amazing families that they included the medical students and residents at barbecues at their house and that sort of thing.
Fun stuff.
And then they were really focused on how they could actually help the patients and help the families. And we're so committed to having this long-term relationship with the patients, which I found so appealing. So that was really sort of the journey into that. And still to this day, when I think about the aspects of clinical care that really meant the most to me over time were those relationships that I developed with patients. And believe it or not, some of my patients still have my cell phone number. And, especially around Thanksgiving or the, Christmas holidays, I'll get these texts from patients that maybe I did a transplant 20 years ago.
They remember you.
Yeah, they remember me and send something, keep me updated, with family events. And that's really, it's indescribably special.
Right, special experience. Thanks for sharing that. Now, let's get right into it. Your passion is helping the healthcare industry with providing compassionate patient care. Speak to me a little bit about that, as we know that's kind of missing, right, in today's patient care.
I think so. I think, and it's compassion from both the perspective of the patient and the caregiver. And really, as I started thinking, particularly as I started writing my book a year or so ago, I had this amazing editor. And she would really challenge me. She said, first and foremost, who are you writing this for? And how can you tell your story? And what ultimately was the most inspirational events that led to writing this book. And so as I reflected on that, and I thought about a few events where maybe honestly we had missed the boat a little bit with our patient because we didn't understand the context of their life, their socioeconomic status, what they really expected.
Right.
I realized that what was missing sometimes was this human compassion, truly not just empathy, not just understanding the patient, but putting action around that understanding and action and being able to incorporate compassion in the way we look at people in the workforce and our patients and their families. And as I really reflected on it, I thought, that's really has to be the core principle of what drives us, because ultimately the patient healthcare journey, what the patient expects and what they deserve, are truly elements of compassion. And I could tell you one, brief story that really sort of crystallized this. So when I was at Tulane in New Orleans, we did a lot of liver transplants. And we had this one patient who came in after her transplant, and she was always very well put together and seemed to be very engaged with her care, but she kept getting all these different infections. And we couldn't really figure it out. Now, she came from a fairly rural part of Louisiana to the west of New Orleans in what we would call Cajun country, right? Basically along the edge of a swamp. And so we couldn't figure it out. And as a team, I remember that to one degree or another, we started blaming her. Maybe she wasn't taking her medicines. Maybe she wasn't following instructions. Well, one weekend, my wife and I were out in Lafayette, Louisiana, which is about halfway to Houston, visiting some friends for the weekend. And we were driving back. I said, this patient lives in a small town right off the road we were on. Again, very rural. And I said, well, let's just stop. It was Sunday afternoon. I said, let's just stop and see her. So we pulled off and went into this small town, and I happened to know her address. And you know what? We pulled up. She wasn't home, but we pulled up to her home, and it really struck me because her home was what many of us would maybe even consider a garden shed in our backyard. And I realized that, we didn't understand where she was coming from, what her environment was, what she was, the reason she was really getting these infections. And so it did two things. From the perspective of her patient care, understanding more about the real context, we were able to make some adjustments and help her, and she got better. The infections were no longer a problem. But for me, in my journey to think about how could I help improve patient care, that really, in so many ways, crystallized this idea that I had that we need to use compassion to understand more about our patients outside of the four walls of the hospital, our clinic, our operating rooms. We see the patients there, but it's really such a small element or snapshot of their overall healthcare journey, which clearly extends before and after they actually interface with a physician or a nurse or another provider.
Great example. Now, most of us have either been a patient or a caregiver. How do you help healthcare organizations provide high quality education? What are some of the key elements that you're going in and you're teaching them?
Well, this is so critical. And I think, honestly, when we look at healthcare, especially when we compare healthcare to other high reliability industries, we realize that we don't invest consistently in the education or training of teams, particularly when they work together. It's really fascinating, right? Like we will bring people together to take care of a patient for something like a transplant or a heart surgery or a pneumonia, and many times they haven't trained together. They haven't had the same education. So one of the things that I really try to emphasize in my work with healthcare organizations and consulting is that first and foremost, we need to really appreciate all the different stakeholders that touch the patient, that interface with the patient. So from the physician all the way to environmental services and nutrition and food service, we have to realize that that's a continuum, and that what I advocate for healthcare organizations is that we look at what processes we need or want to improve. What are the key outcome metrics that we're trying to achieve? And then how can we educate and train all the stakeholders who have a role and a responsibility to learn not only the best process and what their perspectives of those processes are, but also how to align outcomes with the patient journey. Sometimes our outcomes, and this is where education can be so eye-opening, sometimes our outcome measures are simply within small little areas of processes. Mm-hmm. And we might fix that, but then it could have unexpected consequences in other areas that sometimes we don't understand or realize. And by using education as a vehicle, and I also include simulation training, then we can really peel back the layers of complexity and get everybody sort of on the same page and speaking with the same voice. And boy, I'll tell you, when we do that, you can see people, really sort of people's eyes light up because they feel that they have the knowledge, they have the voice, that people are actually listening to them, and they have a role that all team members acknowledge as important.
You are listening to Rise on the Voice of Nassau Community College 90.3 WHPC. My name is Dr. Heron, and today we're talking with Dr. Doug, who is an international recognized transplant surgeon, educator, healthcare professional, and administrator. Dr. Doug is currently a professor of surgery at the University of Illinois, Chicago, and the president of Process Health Consulting, a healthcare consultancy focused on enhancing and optimizing operations and process flow, emphasizing complex system management strategies to optimize patients' outcomes. He is a speaker who inspires healthcare teams to provide effective and compassionate patient care. Dr. Doug is here to speak to us, especially if you're a frontline healthcare worker, caregiver, and provide key elements of how care should be provided. Despite knowledge and training, patient care remains fragmented, frustrating, and expensive, especially from the patient's perspective. He is also the author of the Process Manifesto, Improving Healthcare in a Complex World. Now, Doc, we've been talking about compassion, and you're giving great key elements. But another key element that you kind of touched on when you provided that example of going to see the patient and seeing how his or her environment was in terms of living. But resources is very important to meet patients' needs. Speak to us about having access and how that will have a huge impact on the patient outcome.
Yeah. Well, there's really, I think, two key elements to that. So you mentioned both resources and access. So first and foremost, we have to, as healthcare providers and healthcare systems, find ways to reach the patient more effectively and efficiently. One thing we did as an example that was pretty unique at the time, after Hurricane Katrina struck New Orleans, and we were looking at ways that we could improve patients' access to healthcare. And of course, much of healthcare was in disarray. Hospitals were closed, people were displaced. So we did things like put surgery clinics into federally qualified healthcare clinics, which had never been done before, for things like diabetes screening, head and neck cancer, breast cancer, hypertension, for end-stage renal disease. And we also partnered with both inner city and rural churches as a way to really reach communities. With respect to resources, so I am so optimistic about the future because one of the core elements that relates to access and the patient journey is aligning resources with individual patient need. Now, one of the challenges we've had up to this point is we've really focused on standardization. And at first you think, oh, well, standards make sense because I want to be treated like everybody else. But the reality is we know that we need standards, but over standardization doesn't necessarily give resources to the people who actually need them. And if we try to give everyone the same resources, A, they may not always need it, and B, the cost is overwhelming. And what we really want to do is use information and data and understanding our individual patient needs to align resources where they are most needed. So a good example would be, some patients need transportation.
Right.
Some patients live in food deserts and their nutrition is poor. And so how can we expect someone without adequate nutrition to recover well, whether they've had an acute illness or whether they've had a procedure or a surgery? And so for those patients we need to identify the risk, make sure that the access mitigates those risks, like the lack of transportation, language barriers, fear of the system. We know that's some people just don't trust the big healthcare systems. That's reality. Exactly. And then also those resources that people need to really have the best outcomes so that we don't lose the opportunity to really address healthcare at the individual level.
So for those healthcare providers and people that provide service to patients, you believe that improving the overall satisfaction, that's important. What are some tools that one could use to possibly change the culture of their organization, those that may be listening to you and thinking, okay, how can we make it better? Maybe they're not doing the things that you mentioned or following up after. Yeah. What are some tools that you believe that, would be most helpful to those organizations?
There's a couple of key things. One is to really embrace the understanding of managing complexity. For too long, we've tried to reduce healthcare to a very linear, as we just talked about, sort of highly standardized structure that doesn't appreciate individual variability. We know that each one of us, you, me, the listeners, we all come to the doctor, to the hospital with our own individual histories, genetics, socioeconomic realities. We're all different. We may have the same diagnosis, but we're all different. So one of the ways, if we think about, how do we manage complexity? How do we help the individual patient? Well, one of the key strategies that I emphasize is to create true teams that bring different strengths and different stakeholder perspectives together to impact patient care. And the second thing is, if we're going to create these teams, and this gets at the core of the culture change, we, especially as leaders, have to relinquish really tight control. We have to empower people to do their jobs, to use their education, their training, their experience, to give them the information that they need at the point of care delivery, and to give them resources that they can align with patient needs. So that empowerment and decentralizing the management is so important. I believe that much of the burnout and frustration that we see, and it doesn't make the news as much as it should, but there is a significant increase in substance abuse, in even suicide amongst healthcare providers. And I believe, and I make this case in my book, that over-centralizing control and not allowing professionals to use their skill and training and judgment creates these, I believe, avoidable high-stress environments. And further, as a patient, we all experience that. We experience the effects of burnout and frustration, and even a term I use when I talk about culture change is learned helplessness. We have great people with great ideas, but we've suppressed their ability to be innovative and creative and effective. And what did they do? They just throw up their hands and they say, well, there's nothing I can do. I'm just going to
They give up.
Get by.
Yeah. Now, our listening audience who are listening may agree that the service in healthcare facilities is not compassionate at all. What would you want to say to those individuals? Because certain things, they have to start from us too,
Yeah. So I think that, I'll tell you one of the really interesting, I think, concepts that I developed when I wrote the book was this idea that at some point in our lives, each one of us is a caregiver and each one of us is a patient. It's an inevitable part of human existence. Now, we may be a caregiver at home to a loved one or a child, not necessarily a professional trained, but I really believe that it's a continuum, and that part of the compassion, the start of true compassion, has to be this understanding that it's not us versus them.
Right.
We're all in this together as human beings, as people, all trying to maintain our health, get access to health care that makes sense for us. And so I really think that's a starting point, and it's super interesting to me if I talk to provider groups or I talk to patients and I use that analogy that it's a continuum, it really resonates, and people take a step back and say, yeah, we're all in this together.
Yes.
So we all have to work in concert to understand what the needs of our fellow human beings are and how we can best address those.
You are listening to Rise on the Voice of Nassau Community College 90.3 WHPC. My name is Dr. Saran Heron, and today we're talking with Dr. Doug Slakey, who is an international recognized transplant surgeon, educator, healthcare professional, and administrator. Dr. Doug is currently a professor of surgery at the University of Illinois, Chicago, and the president of Process Health Consulting, a healthcare consultancy focused on enhancing and optimizing operations and process flow, emphasizing complex system management strategies that optimize patients' outcome. He is a speaker who inspires healthcare teams to provide effective and compassionate care. Dr. Doug is here to speak to us, especially if you're a frontline healthcare worker, caregiver, and provide key elements of how care should be provided. Despite knowledge, training, patient care remains fragmented, frustrating, and expensive, especially from the patient's perspective. He is also the author of the Process Manifesto, Improving Healthcare in a Complex World. Now, Dr. Doug, we've been talking for a little bit now, and I'm just concerned, what keeps you motivated even today to want to ensure that compassion is a part of practice?
Yeah, sometimes it feels like a little bit of an uphill battle. I'm not going to lie. But on the other hand, what really keeps me motivated is the feedback I get from groups that I talk to or people who have read my book, The Process Manifesto, and it struck a chord, and they think that they, as individuals, and this is what I tell people when we're doing education, is none of us can change the whole world.
Absolutely.
I know I certainly can't.
Right.
And we can't tackle everything at once. But, if we have this focus, we can look at small incremental changes that we can influence within our own little sphere of influence. I'll give you one, I think this is a really interesting example. So, like many healthcare systems, the last that I worked for, we were looking at ways to reduce infections in the intensive care unit. And these discussions happen all around the United States, all around the world every day. And people rightfully, they focus on hand washing and cleanliness when you go in and out of the rooms. So I put together a team. We just talked about the need to have these multidisciplinary teams with a variety of stakeholders. And there happened to be one person that I put in the team who was part of the group that cleaned the ICU rooms when a patient was discharged in preparation for another patient. And I think at first this person felt a little bit intimidated. She had all these physicians and different things and nurse administrators. And so she was very quiet. And we really started thinking about it. We were talking about cleaning, and I could see she had something to say. So I asked her, I said, well, what do you have to say? And she said, well, because of staffing problems, challenges that we've had, especially during and now after COVID, we only have one of us going in the room to clean it between patients. Mm-hmm. And do you realize with the modern beds that the mattresses weigh about 100 pounds, many of the mattresses. And she said, it's physically impossible for us to lift that mattress and clean under it. And we've all thought to ourselves, that could be a source of the infection. Now, none of us had ever thought about that before. We were focused on central lines and ventilators with pneumonia and all these different things, which are all important. But, we took the group up, we listened to her, and we said, let's really explore this. And we went up and did a little field trip, and we went into an empty room. And sure enough, one individual really couldn't lift the mattress, certainly couldn't lift the mattress and clean under it. Now, believe me, you don't necessarily want to look under those mattresses because it's a true problem. And so I think this illustrates a couple things. It illustrates how important it is to be inclusive and how important diversity is in the way we look at problem solving, creating those diverse teams and empowering the teams to be able to speak up, to be able to use their perception of the problem to help the group as a whole and to come up with solutions. And so I think, I like that example because I think it also includes compassion.
Great. Well, thank you, Doug, for really being here today. We really enjoy all the information. I'm Dr. Saran Heron. Thank you for listening to this week's edition of Rise, available wherever you listen to podcasts, and always right here on the voice of Nassau Community College 90.3 WHPC.